Hello, everyone. My name is Julie Payette. I am the Governor General of Canada. Welcome to the first of our conversation in the year 2021. Actually, I take a moment to wish you a very happy and safe new year. Today is January 21st, 2021, and we are still in the second wave of the pandemic. If I talk for my location in Ontario and in Quebec, Ontario is under a stay-at-home order, and in Quebec we have curfew every night for several weeks. This is important. This is how we do our part. This is how we make sure that we don't spread the COVID and that we will get out of it. But there's something else coming up, and it's this campaign of vaccination, and that's what we're going to talk about today. And for this, I've invited two very important players in this particular vaccination campaign. The first person I'd like to introduce is someone that's had the kindness to speak with us in June 2020, about 6 months ago, while we were emerging from the first wave and preparing for vaccines. And it's Dr. Gary Kobinger from Université Laval. Dr. Gary Kobinger, as you know, is one of Canada's preeminent infectious disease expert and vaccine researchers. He is the director of the Infectious Disease Research Center at Université Laval, and he's been working tirelessly with his team to come up with a vaccine domestically within his lab. As you know, also, Dr. Kobinger has been working for a long time in prevention and in vaccination against infectious disease. He was indeed awarded a Meritorious Service Cross in 2016 for his work on the Ebola crisis, and as well as an Innovation Award. Welcome again, Dr. Kobinger. Merci d'être là. Thank you for being with us again.
Merci, the pleasure is free for me. Thank you.
So last time we had decided, because we know each other, to go by Gary. I'm Julie. How is it going? There's so many questions about the vaccine now that they are available and reliable. Tell us first how things have progressed in the last 6 months.
Well, listen, at that time, people were asking me, what do you think about the optimistic scenario? And I had said the very optimistic scenario is to have a vaccine starting to roll out in December of 2020, which we have seen happen. And I think this is incredible. We have compressed, and the field has compressed 15 years of normal development of vaccine into less than one, actually, because the vaccine started being available in December. So it's less than 12 months. And this is incredible. It's unprecedented. And and you can see the level of excitement and optimism that these news brought to population around the world, actually.
It does. It means there's a light at the end of the tunnel. And now we're sure of it. We can see it, even if it's shining way out there still in terms of immunizing everyone. But immunizing everyone is a complex problem. So my second guess is at the very center of the distribution and the planning and logistic effort that it requires to get the vaccines distributed all over Canada. And this is Major General Danny Fortin. Welcome, Major General.
Good afternoon, Excellency.
I'd like to say that you're originally from Montmagny, Quebec, and that you have served in many different functions inside the Canadian Armed Forces, but more recently, we actually met when you were the commanding officer of our Canadian task force in Iraq, and we met in Baghdad in January 2019. You are now on secondment to the Public Health Agency of Canada to oversee the vaccine distribution, and you'll talk to us about this. So thank you for taking the time to speak to us today.
Thank you very much. It's a pleasure to be part of this.
So I'll come back to you, Gary, and we hear that this is a new vaccine. It's called RNA vaccine. What is different about this vaccine than other vaccines before?
So I was saying, I think it's important to notice that there's more than one vaccine coming out. There's two approved and a third one that is on the border of being approved. The first one that crossed the line were RNA-based vaccine, as you said. They are basically a messenger encoded into the genetic code that are expressing protein that of interest of a pathogen. So basically, old vaccines or older vaccines were giving the protein. For example, the influenza seasonal vaccine. What is done is that the pathogen, the influenza virus, is grown, is inactivated, and is administered as a vaccine. So we administer protein. In this case, we're giving the messenger that produces that protein. And it turned out that the big advantage of this approach is the speed. It's incredible.
So you're fooling the virus in some way at thinking there's this protein that should get rid of it or something?
Or the immune response, yeah. So the immune response is seeing that protein from a virus without seeing the virus. This is why these vaccines are safe. They don't express or they don't contain any virus. They only contain a messenger that is expressing a very small fraction of that virus that our immune response then is educated to see and respond and defend against. And again, the big advantage of this strategy is the speed to which you've seen those vaccines progress in the clinic. So they have been extremely fast in producing enough doses to do clinical trials and to show efficacy and safety with those vaccines with very high efficacy level, actually. So these are the two first that we are hearing of, Pfizer and Moderna.
And that is, we were saying 6 months ago when we were talking that science would find a solution, but it found a solution very fast. And it's due to a lot of prior research and a huge amount of knowledge that was already there. We, of course, all know that these vaccines have to be conserved at certain temperature. And that is different from this vaccine versus this other vaccine. Right now, I think some of them have to be conserved at very, very low temperature. Can you elaborate on that?
Well, yeah, these RNA molecules are unstable. They degrade very quickly at room temperature, so that's why they have to be kept at very cold temperature. But they are equivalent. We hear that one require colder temperature than the other one. That's because they haven't had the time to document that they can conserve those molecules, for example, on -20, like in a regular freezer, versus even colder temperature, -60, -70. And so this is being done at the same time. I think you have, the field feel confident that soon you will see all these vaccines being allowed to be kept at -20, which has been shown to be good for one of the two, for example, the Moderna vaccine. But this needs to be really well documented, because the last thing you want is to put a vaccine for which you have no data out there in a freezer and then realize that the vaccine has degraded. It doesn't change anything in terms of safety, but of course, then the potency is not there anymore.
Yeah, it's less efficient. And that is at the heart of the problem that you need to solve, Major General, correct? Since you have to distribute this vaccine throughout Canada. We're the second largest landmass in the world, and we have to conserve these at low temperature. Tell us a little bit about your role in planning this distribution and the challenges.
Well, I think you just summarized the complexity that we're facing right now. As the doctor clearly pointed out, those are new vaccines, new technology, really, that have cold chain requirements that are quite unique. It's unprecedented. We're facing a solution of unprecedented level of complexity. And those vaccines, the Pfizer-BioNTech right now, is correctly pointed out, has to be maintained at the -60, -70 temperature. The Moderna vaccine candidate at -20. So that is hugely complicated across the country. And as we indicated in the past, the logistics behind getting the vaccines, the Pfizer vaccines particularly, throughout the country at points of use where they can then, be prepared for immunization, available and prepared for immunization on the spot. And a month ago, we did not know what we now know today. We have more. The manufacturer shared considerations for forward movement from those points of use in a frozen state, in a liquid state, and so on, and different length of time. I think what this shows is the level of complexity in terms of logistics across the country, working with different jurisdictions, with the provinces and territories. That was unlike anything that we've seen before federally. And that required unique solutions here to acquire and then distribute across the country with our logistics service partners, providers rather, and different partners. And that's why a number of Canadian Armed Forces members are here at the Public Health Agency of Canada to help build this robust logistics support, the planning, and the day-to-day operations to distribute this across the country.
And I think you guys are very well equipped to do that, because it is a major operation that deals with a lot of details. But since Dr. Kobinger mentioned that the vaccines are equivalent, the documentations are not exactly the same. Do you privilege using one that takes more conservation at lower temperature into big centers and then distribute those that are a bit easier to, do you make those kind of judgment calls?
Well, first, I think those decisions are guided by guidance provided by various bodies, various tables of discussion, the National Association, the NACI, sorry, the National Association for Immunization, the CIC has also provided guidance that is extremely helpful. It's endorsed by various stakeholders, and that's what the provinces and territories stick to. The territories and the remote and isolated areas, the leadership in those areas have all indicated a preference for the Moderna vaccine at this time because it's easier, a little bit easier to manage. So you will see Pfizer-BioNTech product available to indigenous populations, to remote and isolated areas, but I'd say not as much as the Moderna. Moderna is the vaccine of choice to go into territories and in those hard to get to places across the country, particularly in the north of the provinces.
So when you can't go on a road and you have to carry a -70 freezer, are there small, small types that you can put on an airplane? And is the Canadian Armed Forces involved in airlift and transportation at this point?
The Canadian Armed Forces stand ready to support. They certainly have been in a position to support. For example, they helped deliver quite rapidly those ultra low temperature freezers and the -20 freezers in some remote areas in the country. The vast majority of the vaccine distribution is carried out by our logistics service provider that we contracted federally. FedEx NMR joint venture distributes that across the country. In the case of Moderna and future vaccines as they become approved and available. In the case of Pfizer, it's distributed by UPS. Pfizer's responsible to bring it to the different points in Canada. And then the onward movement to other locations can be done with other more locally with logistics service providers locally. But UPS, on behalf of Pfizer-BioNTech, yes, provides that across the country. So there's a number, as you can see, a number of agents, a number of stakeholders in this, and our role is really to help coordinate this complex operations here from Ottawa.
And to keep track that things are indeed delivered as they are, and it's unprecedented, the complexity and the collaboration that is being seen, and we commend you on this most important work. Dr. Kobinger, will we see a vaccine that is room temperature ever?
Oh yeah, for sure. There is a vaccine that are being that are advancing again through the clinical progression that can stay at room temperature for days and years, over a year at 4 degrees, so in a fridge, if you want a refrigerator. So these vaccines exist. They are just now progressing through the pipeline of clinical development. So we'll have to wait a bit.
So this is good news because there are two questions that we received a lot of questions on today's topic. One of them has to do with priorities. People are asking, well, you know, when am I going to get a vaccine? How do I get myself on the list? Who decides? And the answer to that is it is decided with many stakeholders and partners and researchers and experts, but it is decided by the public health agencies and officials of every province. So if you'd like to know what is happening in your province, we will post on our website a link to the page where you can go to the public health agency of your province. But in the meantime, however, people are also asking, because it's been in the media a lot, about doses. At first, it was advertised that both the Pfizer and the Moderna vaccines would be administered in 2 doses, but now we will change that and we'll administer all the first dose so we touch as many people as possible, and the second dose another time. What do you think about that, Dr. Kobinger?
Personally, for having done 20 years of vaccine development, I think it's the right thing to do. We're talking about the vaccine being rolled out in December, but the reality is that we have to be patient at the population level to be able to reach even just 50% of the population. So that I think we need to wait more in the spring. But in the meantime, I think this approach of delaying the second dose is the right thing to do. In vaccinology, most vaccine, including vaccine-based, like on DNA or presumably RNA as well, the more we wait for the second dose, up to 6 months, the better the result, the protection. And we don't see any impact in terms of on the safety of those vaccines. So I think this was really the best thing to do to save more life by vaccinating as many people as possible. There is evidence that these vaccines, even after first dose, are protective to over 50%. So I think, again, it's a very good decision overall, in my view.
And that's very reassuring, because we all want more people to be vaccinated, and as opposed to, and we have a limited number of doses. And on this front, General, we have heard of some delay in receiving the vaccine in Canada. Can you tell us about this and what impact it has on the distribution?
Well, certainly there are delays, so I'll explain that in a second. I think it's important to highlight that the vaccine candidates that we currently have approved for distribution in Canada are 2-dose vaccines, and experts like Dr. Kobinger has rightly pointed out have opined on the dose spacing. And that the opinion is shared by NACI on the Canada.ca website, and I invite all Canadians to have a look at what were those considerations. But we're clearly careful in managing the doses across the country. For example, we about a month ago, our advice, certainly relaying the position of the manufacturers, our advice to provinces, territories was hold on to the second dose at this time, because it needs to be administered 21, 28 days, and there's data without getting too deep into this. There's data that suggests that you can clearly go a little bit beyond that time frame. But without certainty on the next shipment, the shared advice was that we should hold on to the second dose. Then, as we were able to gain more predictability on shipments, the weekly shipments of Pfizer, Moderna, and the once every 3 week shipment of Moderna, we can now assume the appropriate level of risk in the provinces and territories. And it's provinces and territories in their jurisdiction that have the levers that make those decisions. They are responsible for their immunization plans. Last week we learned...
Go ahead.
I was just going to close off by last week we learned that Pfizer-BioNTech manufacturer in Europe, where we draw our vaccines, had to make the hard decision of stopping part of their production line to retool their production line so that they can produce at scale and their plans is to nearly double their production in 2021. The impact for us is a reduction in the short term and across all the customers in Europe as well. And so that forces provinces and territories, provinces in the case of Pfizer, because as I said earlier, that the vaccine that they privilege in the territories is Moderna. But it forces provinces to rethink the management of the second dose. And we're very much in the middle of those discussions right now with our colleagues.
And it is an important aspect, and that's why when we talk about administrating all the doses that we have to as many people as possible, is because we're all driving, Dr. Kobinger, toward immunization of the entire population. When are we going to reach that level? I know that we got a question from Miss Sutherland in Saskatoon, and she's asking how long will people in good health have to wear a mask? Because so when is it that we will be able to say, okay, most of the population is immunized now, we're safer?
Well, yeah. Well, it's hard to say exactly when this will be. Everybody's hoping for summer, late summer at the latest. But I think we will see what happened. What's important to recognize is that there is very, very exceptionally the case of reinfection, which means that not only the vaccination campaign is building immunity in the population, but natural infection is also doing it, which means that, depending how fast one goes to the other, the magic number is 70%. If we can get to 70% of people protected, we will see the decline of this virus circulating in the population very, very quickly. It will plummet. So this is but we know that even getting to 50%.
But that 70% is 28 million almost.
That's right. So it's a lot of people. It's a lot of people. We have to realize that. But again, even getting to 50%, this is where and why WHO has set the lowest bar at 50%. Normally, we start seeing real impact on the virus starting to having problems spreading within the population when half of the people are protected. So we should see the benefit from there on and get a real, a real control, a real decline, severe decline when we reach 70%. But as you said, there's a lot of Canadians, especially there's a lot of Canadians in remote areas, and to reach them is not that easy.
So from your point of view, General Fortin, will we reach 50% within a few months? What is your most important challenge or your showstopper? Is it acquiring the vaccine or getting it there?
Our biggest challenge is not so much acquiring. I think we have a solid portfolio in Canada. Our colleagues at Procurement, Public Service Procurement Canada have identified a number of vaccine prospects, vaccine candidates in close coordination with the agency here and Health Canada months and months ago. And we're seeing results. And we have, Canada has contracted 80 million doses of Pfizer-BioNTech and Moderna. Just by that alone, that is enough to vaccinate the majority of Canadians who want a vaccine. And we're on track to have that majority having access to vaccines by end of September, so end of the third quarter. More vaccines would be coming online as well. In addition to those, I'd be speculating now as to when they could come online, because they're not approved yet by the regulators at Health Canada. But once they're approved, once they become available as they're produced in mass, some of those would be available to Canadians. But our challenge is the running of the mill, ensuring that we grow at scale across the country to vaccinate as early as April. Perhaps 1 million vaccine a week will arrive in this country. So we need to line up the healthcare or the health workforce to vaccinate at scale. Now, for some of our health professionals to go, well, that's not unlike what we do every year for influenza vaccine. Again, a vaccine that is easier to handle and distribute across the country, but
Well,
There's no shortage of health workforce, but it's lining up all those things across the country that will be a bit of a challenge.
but still, a difference with the flu vaccine is the period in which we want to be effective as soon as possible, and also because not everybody is looking to get a flu vaccine, though we all highly recommend it. Whereas in this case, we really want to have a large portion of the population. In fact, one of our person that provided question, Jeff Mooney from Vancouver, said, do we need to expand our distribution network? Should we ask pharmacists to help out because they're in every community? Is this a problem, or right now you feel confident that everyone has the outlet in order to be able to vaccinate the others?
Oh, that's a very good point. That's exactly the kind of thing that we're working on. As a matter of fact, Monday this week, we had a conversation with provinces and territories to really look to find ways and share best practices on how we can increase the size of that workforce moving forward. The unique cold chain requirements of the Pfizer BioNTech and Moderna vaccine at this time make it a little bit more complicated to handle. But pharmacists, retired doctors, nurses, medics across the country, and various other non-traditional immunizers are raising their hands.
One of them from our questions as well was saying, "I'm a retired doctor and I would like to contribute."
Right.
So
right.
you have
so we're grateful for those Canadians and I would encourage those Canadians to turn to their provincial authorities and let it be known, and they will, because it's a provincial jurisdiction and territorial jurisdiction, and I would invite them to please reach out, and I would also add that provinces and territories are looking at ways to bring down those barriers to make it more difficult for those people to become available to immunize, whether it's licensing or what have you, and those things would be looked at by our partners.
Now, because it's so contagious, do we have a way of, when someone is vaccinated, do they have a certificate that is proving that they've been vaccinated? That's the first question. The second question, and we've been asked that by some of our listeners, is if you've had COVID, Dr. Kobinger, are you considered immunized, or should you get the vaccine anyway? So do we have a certificate, and are we immunized if we've had COVID?
Yeah, these are two very important and the question that are being discussed actively, I know, by all the provinces and also countries. So I think the general feeling right now that is emerging is that despite the fact that somebody can be positive or had been diagnosed with COVID at one point, that it would be prudent to still immunize. That being said, there is more and more discussion now on the other side to say, well, there's no second infection in the large majority after millions and millions of cases. There are exceptional cases to see reinfection. So clearly, natural immunity is sufficient. How long it will last, nobody knows, but nobody knows for the vaccine. So in order to also save on the vaccine doses, this is why these discussions are happening right now. I think we will need to follow right now. The focus is on the priority population, and we'll see. I think honestly, somebody that has been infected that wants the vaccine, I don't see any problem. On the other hand, is it the priority population? This is more how I think it could be framed, and the yes and no I think will come from discussion at the public health level from each countries and provinces in case of Canada. But for the passport, there is already passport for immunization. For example, yellow fever. There's still a lot of countries in Africa and Asia where you cannot go if you don't have your certificate of yellow fever immunization. So I don't think that's going to be any different. I could see that. I think it's very, very likely that we will see that. For whether or not you need a passport to go to the restaurant, I think this also will be interesting discussion that will need to be clarified at the local level and provincial level. But we'll see what happens. I think it's going to be important to keep in mind to not discriminate against people that that cannot be vaccinated, for example, because, for example, of allergic reaction or any kind of reason. So it's going to be important to not discriminate against.
So how do we determine that? Actually, I had a very question from Jennifer Conley of Calgary. She was asking, can those with chronic health condition or immune compromise be vaccinated? And how do you determine if someone is going to be allergic ahead of time?
So this is really to see with their healthcare provider, your family doctor, your doctor that you're saying. This is very important because there's so many different cases. There's no, from a scientific perspective, counterindication of vaccinating and immunosuppress is just a waste of dose because the person will not mount this protective immune response. But again, it depends what level of immunosuppression person has. If it's a chemotherapy, it may be better just to wait. If it's chronic, there's all these scenarios. It's better to see with your healthcare provider. Same thing for the allergic reaction in terms of what past you have had in having anaphylactic reaction, so very severe like allergic reaction. Right now, the counterindication is if it's against any component of a vaccine in the past. This may evolve to include others. We will see. But again, I'm from my own perspective, my own opinion, I think it's important to not penalize people that decide not to get vaccinated. I think vaccination still today, if you're not impacting on somebody else's life, if it's your own, I think you should decide. You should choose for yourself, and we will see the large majority of people going for vaccination. It's always like this. Of course, if you work as an healthcare worker and you treat people that cannot get vaccinated for all sorts of reasons, including people in cancer therapy, I think it can make sense to force these people to have a vaccine in order to protect the people they're working with that cannot get vaccinated. So all this needs also to be, it's a discussion in terms of ethics, in terms of
it's a societal, and it's really important because when you work with vulnerable or more at-risk population or people, then it becomes a duty to be vaccinated so you can provide the service without putting them in danger. I have one more question, which of course is in also the mind of the people, is that right now we have Major General Fortin and his team distributing vaccine on a very complex pan-Canadian distribution. And that vaccine has been developed on the first mutation of the vaccine. Dr. Kobinger, is it possible that the mutation will not respond to this vaccine?
It's very unlikely. Listen, it's very unlikely, but put it to the worst case scenario. Let's say there is an emerging new strain that can evade, largely the immune response, which I think would be very surprising, honestly. These vaccines, again, the strength that they have is they're very fast. It will take several months, again, to do and adapt this vaccine, but it's possible. It will go much faster than the entire development that we know also. So, but from a general virology and vaccinology perspective, very, very unlikely. We will see what the data are when they are. But what we're seeing right now, again, even in the UK, where they saw they detected the first emergence of an important variant, is you don't see reinfection. And this is very important from natural infection, which means that if you have a good vaccine, that vaccine should be able to protect you against the different emergence of different variant that this virus come up with within a normal evolution of the virus in adaptation to the human population.
Well, I don't know about the listeners, but what I've heard today from both of you, Major General Denny Fortin and Dr. Gary Kobinger, is extremely reassuring in the sense that if we are patient and we keep steadfast, we will emerge and we will meet again. I cannot thank you enough. Really, and I will do so on behalf of all Canadians for the work that you do, for the expertise that you bring, for the dedication that you have to your task. It's very reassuring to see you, the teams that are working with you, and so many other Canadians that are making a difference. Thank you very much for these comments, and perhaps the next time we meet again, it's going to be to do a postmortem on this and not in the midst of it. But right now, we are still fighting, and the best every single one of us can do is to stay safe, to stay as far distance as other people, and so that we don't become a vector. And then as soon as we can, for those, as you say, Doctor, get vaccinated. Again, thank you very much. Thank you. And for those listening to us today, on next week, we will tackle another important problem or issue, maybe that has been a little overlooked because of the prevalence of the infection at the moment. And it's what months and months of confinement and distancing and teleworking and isolation in many cases does on the well-being of people. We will talk about mental health. Thank you for listening.